I'm over here at JOI in the San Marco area. I'm joined by the chairman of JOI, Dr. Steinberg. I really appreciate you joining me here. I got a question about my finger in a second. I know you're a hand expert, but first, for those out there who don't know about JOI, what do you guys totally do at this place and all the facilities you have around town?
Yeah, we offer the full gamut of orthopedic surgery and rehabilitation care. We take care of professional sports teams, and we're well known for that in the community, but we do a lot more than that. Take care of fractures. In addition to sports medicine, we do arthroscopy, spine care, hand and upper extremity surgery, foot and ankle, just to name a few. And just recently we added orthopedic oncology, which is taking care of orthopedic tumors or bone tumors.
Wow.
And we teamed up with MD Anderson, and we offer that service as well. We like to do it this way, which is if a patient has an unusual x-ray, which we come across quite often, or an MRI, instead of going directly to a cancer center, we have a cancer expert for tumors of the bone in JOI now.
Oh, wow.
Who will then see the patient and, if necessary, refer on. But the vast majority do not need to go to a cancer center.
That's great for the patients. In the community, you guys do a lot of stuff in the community to help those in need who may not be able to otherwise afford it, right? We
do. We do multiple community service activities. To name a few, the Arthritis Foundation is something that we participate in, the Humane Society, the Police Athletic League. Many people know we've teamed up with some of the football players, including Blake Bortles. We put on a camp every year. It has 500 kids come out, and it's completely booked. In fact, we're thinking about expanding it this year, and it's a football camp for the kids. We also take care of the homeless at the Solzbacher Center.
That's amazing. That's amazing. As a citizen of 23 years here in town, I want to say thank you to you guys for doing that for those in our community. Speaking of expansion, you guys are building some new facilities, right?
Yeah, we're right now, we have 35 docs, 7 physician offices. We have 11 rehab centers. There are 64 therapists that we serve the community. St. Johns County is fast growing.
Yeah.
We just opened a new office in Nocatee.
Okay.
And our Baptist South office, which already has expanded once, will now double expand into the MOB3, the new building that's going up. We're going to have the entire third or second floor of that building and have rehab in it as well.
It's sad that there's a need, but great that you guys are here in town and constantly able to expand into all the different areas. And one of the really cool things that you guys are always doing is you're on the cutting edge of technology and rehab. And living in Jacksonville, we get to benefit from it. These we've talked about. These are amazing. This Active Armor?
Yes.
How has this changed the game for you?
The Active Armor is sort of an interesting thing. We like it because it's another option instead of a splint or a cast. And there are many people out there who don't like either of those two things. And the advantage of this is super hard plastic that's as strong or stronger than a cast, which allows access to the skin so you can take a shower. And it is it's 3D reconstructed on the system that perfectly fits it to the extremity. So whatever shape or size, this thing fits. And we've had patients, we've had athletes, including professional athletes, use this successfully.
No, I definitely, again, hope I don't need it, but really, I had a cast once, and having to put a bag over it in the shower, this is way better. Really appreciate your time. Again, you're a hand expert. I know we're out of time here, but is there anything to do for that? It doesn't straighten.
Can you make a tight fist for me?
Yeah.
All the way down. So you can do that. Can you straighten it all the way out?
I'm good?
I think you should leave that alone.
Okay. It's not affecting the golf swing, so I'll leave it alone. Appreciate your time. Good to see you. Good to see you, Doc. All right. That's all we got from here. We got more coming up on First Coast Living. Stick around. We'll be right back.